Hello, teacher. This is my pronunciation and translation chapter 10 of the workbook. Chapter 10, Primary Care. A. A National Health Service. The National Health Service is responsible for health care for everyone in the UK. Although a small number choose to pay for private care, treatment is free, but there is a prescription charge for drugs and appliances such as a cervical coil, with exemptions for some patients, such as children and the elderly. Primary care is provided by general practitioners or general practitioners or GPs is sometimes known as family doctors, nurses, dentists, pharmacists, and opticians. GPs work in practices of 1 to 20. Practice are based in surgery and look after the health of from 1,000 to 15,000 people in their local community. They also provide health education in areas such as smoking and diet. Run clinics give vaccinations, for example, for influenza, and may perform minor surgeries such as removal of warts and moles. If a patient needs specialist care, the GP will make a referral. Refer to refer the patient to a consultant in secondary care. Patients are normally seen on an appointment basis. Home visits are made when patients are housebound, unable to leave their home, or too ill to attend surgery. Out or attend surgery. Out of hours treatment from 6 p.m. to 8 a.m. is provided by the local primary care trust, which organizes shifts or GPs and local GPs to cover if someone is absent. Note: the noun surgery has three meanings. The building where GPs work. The practice has moved to a one surgery on the High Street, a time when GPs see patients. Morning surgery is from 8 8:30 to 12:30. The work of surgeons. The patient needs urgent surgery on a burst appendix. B. The practice team. A typical GP practice employs exceptionists. No. A typical GP practice employs receptionists. They are responsible for initial patient contact, making appointments, taking rickets, for repeat prescriptions, taking massages from patients and other healthcare providers, and for filling and scanning documents into um, patient records. The patient's manager has a responsibility from finance and something for it, for um, IT supervises exception staff, iris locums, and help prepare the practice development plan. Practice nurses run asthma, diabetes, and cardiovascular disease clinics has one-to-one clinics for those who wish to give up smoking. In addition to practice staff, GPs work with a number of health professionals. District nurses we visit temporarily housebound patients, such as recently discharged hospital patients, to charge dressing, such as ulcer dressing. Health visitors visit families to carry out checkups on young children, particularly under fives, to make sure they're healthy. Special attention if paid to families in need, such as those living in poverty. They also do baby immunizations, midwife, room clinics for antenatal patients, physiotherapists provide hands-on treatment but also teach patients exercises they can do to improve their condition after an accident, an accident or operation. C. GP's Day. Dr. Stewart works in a practice in a small market town with three other family doctors. The surgery is in the center of the two and is shared by three practices. This is a typical working morning when she is not the duty doctor, responsible for emergencies, and urgent problems. Okay, 8 a.m. arrival at the surgery. Check the out of hours email printout. Check for urgent and non-urgent massages. 8:30 a.m. Check emails from the health board and partners prepared for surgery. 8:30 to 8:30 to 10:50 a.m. morning to 10:50 a.m. morning surgery, 10 minutes appointments, 6 pre-broken last week, 2 broken 48 hours ahead, 4 brokeable on the day, 10:50 to 10:50 a.m. Check with reception for massage, seeing prescriptions, and deal with repeat prescription chart. So, well. Um, 11 to 11:20 a.m. coffee break in the conference room with collages. 11:20 to 11:30 a.m. check home visit tickets and divide up visits. 11:30 a.m. to 1 p.m. home visits.